Schools are set to reopen amid a surge of COVID-19 cases statewide. Infections are reaching record levels right now. To get some important perspective, we're joined by Dr. Vandana Madhavan, a clinical director of pediatric infectious disease at Mass General Hospital for Children. Doctor, thank you so much for joining us this morning.
Thank you so much for having me.
Well, let's start with the all-important question right now. How concerned are you about kids headed back to the classroom tomorrow?
I first want to say it's a combination of excitement that they are able to go back to school. Because if you think about a year ago, the majority of kids weren't in school, or if they were in school, they were in hybrid programs. So it's great that they are able to go back to school. And I think the important word is vigilance. I think we need to continue thinking about, all of our different tools in our toolkit, especially as we're in this Omicron wave, knowing that it's more transmissible. So I think we need to be vigilant and aware, but worried, but in a sense of worried in a healthy way to allow kids to be safely back at school.
Okay, I want to ask you about parents of kids too young to be vaccinated. I do fall into this category. You hear that Omicron is mild, but what about this group that still doesn't have the vaccine? How concerned should parents be?
So of course, data, are still evolving. We're still learning more about the impacts, but information that we have so far does show that while Omicron is much more transmissible, meaning that one person who is sick with Omicron can infect more people than with previous variants, including Delta. Omicron in some places has been up to 2 to 4 times as more transmissible as Delta. So more people can get it. Also, we are, seeing that people who are fully vaccinated with 2 doses of the mRNA vaccines can, have breakthrough cases. We are also learning that Omicron cases are milder, that people are less likely to have symptoms bad enough to warrant coming into the hospital, needing the intensive care unit. And so I think it all needs to be put into context that while an individual child is still much, much lower, is at much, much lower risk of needing hospitalization, needing to come in, because it's much more transmissible, more people are going to get sick, and therefore more absolute numbers are going to need the hospital. And so putting into context and really thinking about each individual activity. Obviously, school should be a priority. School is so important for kids, not just educational development, but their behavioral and social development. And so finding ways to keep kids in school and making sure that schools have a good system in place, that staff members are vaccinated, especially if the little ones aren't able to be vaccinated. Masks are required. Thinking about the kinds of masks, because Omicron is more transmissible, cloth masks may not be as effective. And so thinking about what kind of mask your young child is best going to be able to wear. If your child is over 2, making sure that the school has good systems in place for testing, for identifying, for keeping kids out of school, and thinking about prioritizing those activities that are going to be most beneficial to your child and to your family. So visiting, grandparents that you haven't seen for over 2 years over the holidays may have been something to prioritize. Taking your child into a restaurant right now is perhaps not the thing to prioritize. Thinking about what activities are safer and what the benefits are to your child and to your family.
Okay, there are certainly lots of decisions for parents to make. Dr. Madhavan, clinical director of pediatric infectious disease at Mass General Hospital for Children. Doctor, thank you so much for joining us this morning.
You're welcome. Thank you.